Okay, am I going to be on the tangent where I'm going to go off about sometimes how wrongful our medical system really is? You know,
Yeah. So I know we've kind of thrown around a couple of terms here. So if you could just maybe give us a brief definition on some of these terms that you've used so far in our discussion. I think we've talked about deductibles, we talked about co-insurance and premiums. If we can maybe give someone an idea as to, if there's an easy way for them to kind of take a look at whatever plan that's being offered, such as, a PPO or HMO and a HDHP. Um, in using that terminology, is there an easy way that they can maybe look at those plans and assess, this plan may be better fit for me, whether there's a higher deductible, lower premium, and vice versa?
so the first thing is you have to assess your health first. You have to see where you are, when it comes before you pick out an insurance plan. The deductible is the amount of money that somebody would have to pay out of pocket before insurance begins to pay. So typically with rather low deductibles, like a $1,750 deductible or maybe a $2,500 deductible, very easy for someone to pay. Compared to something that's a $6,000 or even an $8,550 deductible, where it is a bit of a stretch for someone's bank account.
Yeah,
Okay.
I agree.
I mean, but you have to think about, how much money do you have in the bank? How much money do you think you can save in the bank if you choose a high deductible plan, and where your health is today? If you're healthy, you don't have a whole lot going on, you might have a script in the event that you get flu, then you have to understand that with picking a high deductible plan, your flu visit isn't covered until the full deductible is met, on top of copays. So copays are what you pay out of pocket in addition to your out of pocket expense towards the deductible, except for wellness. Wellness, if you have a copay, that's it. That's all you pay. You're not going to get a bill in the mail. Okay. But plans back then didn't have copays for wellness. So why are we paying 25, 30, or $50 extra out of pocket for a service we know is already going to be covered at 100% with the insurance company?
Mhm.
Another thing is, understanding sick visits and injury visits when they do happen in specialists. Copays are what you pay up front. You still will get a bill in the mail. So there is this myth that people think that there's no other out-of-pocket cost after they pay their copay.
Yeah.
If, knock on wood, they go to ophthalmology and they're diagnosed with something, and it's simply not true. After the annual deductible is met, then the plan is going to split into co-insurance, where the patient and the insurance company split the difference until the maximum out of pocket is hit. So then we look at what's better, a 60-40 plan versus an 80-20 plan. Well, the whole goal is to have the insurance company spend the most versus you spending the most. So if you can afford it, you want to pick an 80-20 plan type of co-insurance, or a 90-10, or even a 70-30, because it's less exposure to you, more exposure to the insurance company.
Okay. Do you have any websites that anyone that's looking for health insurance plans, or maybe they can kind of play around with looking at their age, any type of health conditions that they may have, or anything within that nature, so they can get an idea as to how much they're paying out of pocket? Because the 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 whole thought of even having this interview is just letting everyone know that yes, you can go and you can pay enormous amounts of money when it comes to taking care of your health. But then there's another aspect of this too, is, why not do the work up front versus continually depending on a plan and shelling out money that you could possibly use for living another version of your life, maybe even a fuller and a much happier version of your life. So I'm just curious as if there's a website that anyone can go to kind of look at and do cost comparisons across plans.
So each state is set up differently. Pennsylvania, DC, Nevada, Colorado, those states have their own healthcare exchanges. Okay, where same thing with Maryland, they have their own healthcare exchanges. So those sites can be a little cumbersome to find, but the best site that you can find with a zip code that's going to give you a transition to the state marketplace for Pennsylvania, Colorado residents, Nevada, DC, and Maryland is to simply put the zip code in, and it gives you the link right there for you to go into the website that you're looking to find without you having to get lost in Google, and filling out forms that, you really don't even know what you're filling out, number one. And two, are you even working with somebody who's affiliated with the public healthcare exchange? And that's going to be healthcare.gov.
Right, everyone, I'm going to pause the interview right here, and I'm going to go to the website that Kat just referenced, healthcare.gov. Once you log into the website, you're going to scroll a little bit and you're going to click where it says Get More Savings. Go ahead and click that. To the right, you have a couple more options under Get Started. You can either go into create an account, or you can just maybe preview the plans. If I'm just trying to get an idea as to out-of-pocket expenses or costs, or where I should be in terms of pricing, I'm just going to do a preview rather than committing to creating a plan or creating an account. So go ahead and enter a zip code here. And that's what I'm doing now. Here now you have the opportunity to tell a little bit more about your household so that it can be a little bit more customized and accurate in terms of price plans comparisons. So I'm not going to do that in sake of time, but you do have the option to do that. So I'm going to go skip this part of it, and I'm going to go straight to see full price plans. All right. So now you see a price plan comparison that kind of gives you an idea as to what you're looking at on average in terms of what you should be paying out of pocket when it comes to your premiums. So there's the bronze, silver, and gold. And again, when you're going through this exercise, you want to make sure you click. You want to make sure you click the option where you can give a little bit more detailed, so you can get some a little bit more accurate pricing when it comes to plan prices. Okay. All right, back to the interview.
Healthcare.gov is a site where even New York residents, Florida residents can take a look at the rates, and they can even go in and take a look at different zip codes to see how the states compare, because some of us are dual state and tri-state residents. And so it's great to know, where am I going to get my best deal if, I live in Ohio, for example, but I also have another address in West Virginia. What's that marketplace going to be like? Or somebody who's dual state between New Jersey to New York, figuring out, what those markets look like. And people can go online and they can explore that. And also, what's interesting is inside the website, it will also give you, it'll tell you like popular things to think about, like the average cost for type 2 diabetes, that you're going to be subjected to pay, or the typical cost for maternity, from prenatal care to delivery, what your out of pocket's going to be there on some of those plans. And they're all inside the healthcare summaries on each plan, when it comes to finding out those two popular things. So then you can kind of assess, okay, if I'm not pregnant and I don't have type 2 diabetes, what's my out of pocket potentially looking like if I'm healthy versus if I have other conditions going on? How do I assess that?
Okay, very
also,
good.
A tip would be to meet with your doctor. Your doctor can kind of assess you and say, hey, you're coming to see me 3 times a year, or you're coming to see me 2 times a year, what those charges look like before they get submitted to insurance. So then you kind of have an idea do I want to go high deductible, or do I want to have a low deductible where I know I'm going to be the least out of my pocket if I can afford the plan?
Gotcha. And that makes perfect sense. And there are a number of great things about you, Kat. And I know I've shared this before, especially when I was just taking a look at your IG page. I mean, you're full of a wealth of knowledge when it comes to health insurance. I mean, you've been in this for 5 years or so. And the neat thing about you is that you're licensed in 23 states. And I was very impressed to see that you won the Most Trusted Agent Award in 2019. So just to kind of share that and let everyone know. To be licensed in 23 states, how does that look? I mean, is there a way that you can maybe explain it or paint a picture as to, what's involved with you holding a license there in 23 states? What can you offer?
So with an insurance license, number one, the healthcare system is very regulated. Okay. And especially when it comes to insurance, and because we know the medical system is very regulated. I mean, when you walk into a doctor's office, you have to sign a HIPAA form. I mean, right off the gate. Same thing when it comes to insurance. It's very regulated, and that's for insurance products. Now, there are health plans, and then there are insurance products. Very different. And so me being able to hold a license in that state, that means, number one, I've went through a criminal background. Okay, I've passed it. There's nothing on my criminal background that says that I can't work with somebody. So that means I'm not in trouble with the law, which is great, because you don't want somebody to know your business. The second thing is I've went through the testing that's needed to be done in order to qualify, that states the education of what I had. And that's just based on through the state, where you have to take a test. You have to, it's actually health, life, and annuities that I took my test in. And it's a very hard test to take, because you're just graded on so many different metrics as far as your knowledge and skill on, can you understand the products, that's going to be available to the public. Even though I don't sell life insurance, I refer out for that business. It's still something that I need to know the basics of in order to be able to hold that license. And I take pride in that. It's a very dedicated thing. So for every state that I'm licensed in, it's because I've put the time, energy, and effort in to be able to say, I want to help people in this state. People, no matter what country, no matter what state we're in, we could be Georgia, we could be Alabama, we could be Mississippi, we could even be Texas. Everybody wants affordable health care. People want to understand the medical system. So me being licensed allows me to talk about HIPAA related things, okay, with the client, because it's their health. Whether it's calling a doctor on the phone and asking them for assistance with a patient on the phone, right? A license allows me to be able to do those things for clients. They're not in this alone. We all have to make sense of it. We try to, and we just want to understand, with insurance, how does this all fit in, versus somebody who's not licensed. There's some compliant issues there. And as a matter of fact, if, depending on the state and how they're set up, with their strictness, if you don't show state license, you are simply not allowed to operate in that state, or even talk about health insurance, or even talk about, someone's medical history. And so it's a very, very regulated system, and you can get in a lot of trouble for it. You can be fined if you do it.
Gotcha. Okay. All right. Well, very good, Kat. I really appreciate you taking the time to sit down with us. And I'm going to add where you can contact Kat should you have any follow-up questions. She's very easygoing, easy to talk to, very knowledgeable, and she's very passionate about what she does, which is very important when selecting anyone when it comes to working with and and looking for business, excuse me, to support. So with that being said, again, I thank you for joining me, and I look forward to speaking with you in the future.
Awesome. Thank you.
Okay. Thank you, Kat.
Why do we give the medical system so much power?
Yes.
Okay, so they went to school, they went to different schools. Okay, and you've went to school, I've went to school,
Yeah.
we've all went to school.
Yeah.
But we put them so up here, and it's not a disrespect to the medical system. It's like, but we put them up here and it's like, why?
Yeah,
Okay.
exactly.
When there's
Exactly.
thousands and thousands of medical malpractice cases that nobody
Yes.
wants to talk about.
Yeah, time and time again. And yeah, time and time again. Yeah.